Okay, we're going to do what's called a correction of a fibular head dysfunction. Remember that the lateral hamstring attaches to the head of the fibula, and the lateral hamstrings tend to get hypertonic, meaning they tend to go into a contractile state, not as intense as a cramp, but still a chronic pathologic state in which they stay contracted, and that has the effect of locking up the head of the fibula, which does two things. One, it can hit the fibular or peroneal nerve, which can give you pain. Two, it limits the ability of the tibia on that side to internally rotate, and that affects how well you can pronate. And if you can't pronate properly, that's going to affect your gait and can cause all kinds of problems and ramifications. The correction of that is actually pretty straightforward and easy. We're going to use your everters, your fibular peroneal muscles. They attach to the anterior surface of the fibula, and when they exert a pressure in an isometric way, they're going to draw the fibula forward. We're going to assist that with just straight on pressure with our thumb. And so what we're going to do is to make these isometric contractions, you're going to put your right heel, cross your ankles, put your right heel against your left forefoot. What you're going to be doing is exerting pressure with your left forefoot in an abduction or in an outward way, turning your foot to the left. And again, in an isometric contraction, the heel is going to hold it so it doesn't go anywhere. So the effect's going to be the everters will pull the fibula forward, helping to unlock it. We're going to help that out by putting your hand in kind of this position. Use your thumb right on the posterior aspect of the fibula. Now the fibula is going to be right up next to where your knee bends on the lateral and slightly posterior side of the tibia. And you're going to exert pressure. Now that pressure is going to be in a bit of a anterior but lateral direction. So it's going to be kind of this way, and that's because they're positioned this way, so you want to push it that way to unlock it. So you're going to put your thumb here, and now I'm going to exert pressure in what I call the 3x3 rule. Turn your foot out against your heel, 1,000, 2,000, 3,000. At the same time, I'm putting pressure against my fibula in this direction. Take a rest, and I'm going to take my heel and deduct my foot, or turn it inward a bit. And I'm going to repeat that again the second time. 1,000, 2,000, 3,000. Relax again. Again, use your heel, go a little bit more in adduction, or turn your foot inward a little bit more, and one more time. 1,000, 2,000, 3,000. Now I'm going to uncross my ankles, and I'm going to take my forefinger and my thumb and just kind of work that fibular head now and make sure it's nice and loose. And the way I'm going to do that is, again, I'm going to exert, and this will be just a slight bit of motion. If you're getting a lot of motion, you're probably not got a hold of the fibula itself. You don't want to move the flesh, you just want to move the bone. So grab the bony head, you're going to kind of go in an anterior, again, lateral position, and you just wiggle it back and forth. I tell people, think of it like wiggling a tooth. It's not going to go very far. And you're done, and what you'll find is, number one, you may have less pain through here, anywhere from your ankle on up. Two, it should restore the ability of your tibia to internally rotate, which in turn will give you better pronation.